Welcome to Tea with Huangdi. I'm David White. I'm the Director of the Institute of Neijing Research here in Sydney, Australia. Tea with Huangdi was a concept that was developed around a decade ago by myself and a number of students of mine for the purpose of delving deep into the concepts of the Huangdi Neijing and into concepts of the culture, language and philosophy that surrounded the Huangdi Neijing as well. The concept of Tea with Huangdi was, of course, to drink fine tea and discuss aspects of the text. Originally it was done as a read-through, where we would just read one chapter, discuss concept of that chapter, ruminate on those concepts and see how they would impact us clinically, or how they might impact us in our day-to-day lives outside of a clinical practice. In 2012 I created the Institute of Neijing Research, the INR, and started looking at how I can teach the Neijing lineage that I'm part of to a more global community, to develop classical medical studies around the globe. And that has now developed into also online studies as well as practical workshops. In the time of COVID, the Tea with Huangdi series now is going to be online, and rather than a group discussion to start off, it's going to be more myself answering a few questions or going through some particular concepts of Neijing medicine. Namely, today we're going to be talking about acupuncture technique, and not just Neijing acupuncture technique, but the principle behind all acupuncture technique as it was discussed in that Han period. Of course, the concept of this as well is casual discussion. It's not going to be about specific technical aspects of needling methods as much as it's about how we should approach all needling methods. And I think that's a very important aspect of all acupuncture as well. So to introduce a few things, firstly, the tea that I'll be drinking, and I always go by the philosophy of the right tea for the right moment is the one that's right in front of you here and now. So whatever tea you have is perfect for this discussion. I happen to have chosen a rather important tea to me. I am certainly a tea fanatic. I am no tea master by any circumstance. I have no training within, cha dao or any element of other ceremony. I just enjoy good tea. And the tea I'm drinking today is it's a pu'er tea. It's a raw pu'er tea, Mengfei pu'er tea, and it's a 2010 autumn pu'er tea as well. So really this is more for my Northern Hemisphere followers who might be more, well into their fall or autumn season. It's what we call shang. It has autumn aroma to it. It's a very beautiful tea. Has a lightness to it, but becomes thicker and thicker with each brew, and also develops a very delicate and very delicious pu'er style oil and cha qi to go with it. It's from Mengfei Mountain, which is in Yongde County in Lingang. I bought this, as I mentioned, in 2010 from Yunnan Sourcing. If you're not familiar with Yunnan Sourcing, I highly recommend that you look them up. They make including this one, but they also source, obviously, a number of wonderful teas from around China and I believe Taiwan as well. Some of the teas that we'll go through are going to be very simple teas that I drink every day. This is, because of its rarity, is not an everyday tea for me, but it's something which, to me, really delves into the concept of beautiful aged tea, in that flavors become really richer. You can sit with it for a long time, and that's much like our classical medical texts, is we can sit with them and we can brew over them, and we can sit there while we look at the same line and the same chapter and the same concept over and over again and experience something new. And that's one of the most important aspects, in my opinion, of good aged tea, and of course a good aged text such as the Huangdi Neijing. So, in light of that, what we're going to be talking about here is, as I mentioned, the nature of needling technique. There's a lot of aspects to needling techniques, and there's a lot of variations in needling techniques, depending on what style of acupuncture you may be practicing. If you're practicing a classical style of acupuncture, of which really there are only two, which is Neijing classical acupuncture stemming from the Huangdi Neijing, or Nanjing classical acupuncture stemming from the Nanjing. The Nanjing certainly is the more popular one in the modern day, in that as a style of acupuncture, a particular method of acupuncture, we can see a number of different schools that have grown from that and are practiced in that way. Japanese acupuncture, Toyohari meridian therapy, those sorts of things are developed heavily from Nanjing. Not 100%, but heavily from it. And you can be a classical acupuncturist and as long as you're working with the principles of the classics. And that's what the focus is going to be of these initial talks. The Neijing as a text, and this is something that I teach in my institute, is something that, because of its cryptic style, because of its multiple authorship, and because of a number of different ways in which it can be interpreted, the concept of Neijing medicine as a style becomes a little bit difficult. For me, it's Neijing medicine as was passed to me through my teacher. And so therefore my acupuncture technique revolves around what I've been shown and what I've obviously experimented with, but with that underlying principle of Neijing theory and Neijing medicine. It is not a direct lineage from the text all the way 2200 years ago to David White today. That would be pretty much near impossible. However, having said that, it means that we have multiple interpretations of the same lines within the Neijing. It means that what I may say about needling in one way, or what I might say about medicine in one way, is said differently by someone else, and that's fine. The goal of what I wanted to achieve today is to give you an understanding of this broad application, something that hopefully you can just store in the back of your mind so that as you go to approach needling tomorrow, you're able to needle with hopefully a little bit more finesse, or hopefully a little bit more consciousness as you approach your patient and in order to help your patient. We're still going to obviously be referring to the Neijing, but as I said, I'm not going to go through certain particular technicalities of the individual needling methodologies listed in the Neijing. That's a different talk. And in light of that, we're going to talk about two key principles with needling technique. Whenever we grasp the needle, we're going to be doing a few things. One, quite simply, we're grasping a piece of metal. Two, we're going to be then engaging with the individual. And it's an engagement which happens in multiple levels. It's an engagement with self, it's engagement with how we are grasping our strength of our grip, the way we hold the needle, the way we are breathing, and also the information or baggage we may be taking from, it could be our entire lives, it could be that day, it could be the weekend before, or anything like that. We're going to be taking that information with us when we go to needle, or when we go to palpate to get information regarding on where we should needle. But the engagement is the key thing here, and the engagement with the patient is the one which is at the absolute priority in when we actually go to needle. In Ling Shu Chapter 1, the Jiuzhen Shurayan, which is the 9 needles and 12 source points, it has some very choice lines about how one should needle and how one should approach the mentality of needling. One thing it says is su shou guan, shang shou Shen, which means the coarse or the inferior guard the xing, which is the form, and the superior, as in the superior physician, is guarding or defending that of the Shen. So probably one of the most famous acupuncture lines in all of medicine, and something which is repeated over and over again. But the concept of this guarding or defending this idea of the Shen is at the absolute core of every aspect of needling that one should have in their mind as they approach their patients. So what does it mean to guard the Shen, or more importantly, how do we define the Shen? So I used the term engagement prior. You know, if we're engaging with something, that already is triggering this concept of Shen, or triggering the Shen within the individual. If you are engaging, it means that the Shen comes back to this concept of perception and reception of information. Okay? Perceiving the environment around it, receiving that information, and then also relaying that information. So that when we needle, if we engage at the right point, at the right time, with the right technique and the right tool, then we are going to basically engage and communicate with that individual Shen in order to manifest a healing response. I mean, that is the simplest way to describe needling or acupuncture. Shen often is translated as spirit, and understandably as well. You know, the etymology of the character is an individual kneeling at an altar. And by kneeling at an altar, it means that in our physical form, there is an element of communication to the unseen, that is which is manifest. So by communicating in that way, then we're connecting to things such as spirits, or the spiritual aspect of something. And it's a fine translation, but it's not an all-encompassing translation of how we may approach Shen within the medical texts. So often we will talk about Shen, or often I will talk about Shen in the Neijing as being something which illuminates something else, something that brings light to something else. That is what the Shen is. Because the Shen manifests and is within the heart, it is fire, it is pure yang qi. And what we are trying to do is we are trying to draw that pure yang qi to a certain area so that we can create and facilitate change. Or, ideally, we're even trying to guide that yang qi away from an area. And this is the difference between bu and xie, which is between supplementation or tonification, whatever term you wish to use, and reduction or dispersion. When I teach needling to my undergraduate students, I try to talk to them about engagement of the Shen in a similar way in which one may engage with a wild animal. If you have a wild cat, and always a cat's a good one because they are super alert, their Shen Ming is just bouncing off the walls. If you're trying to engage a cat and you want to actually draw that cat, the cat being Shen, to you, then you're going to be doing it in a very subtle, slow, and gentle manner. You're going to maybe entice it with something in your hand. You're going to talk to it softly. You're going to engage an element of trust with that animal, with the cat. You're going to slowly bring it to you with slow movements and quietude as you try to enable this fragile creature closer to you. The enticing with something might be warmth. Okay, if we think about it from a zhenjiu aspect, where we might be using moxibustion to draw and slowly gentle pull that yang qi to an area. Moxibustion being that primary supplementation technique discussed in the Neijing. We might be doing it with a slow, gentle needling technique. Same sort of thing. Now, on the other hand, if you want that cat to scatter, if you want it to get rid of it, then you're going to be going to it with loud noises and waving your arms and creating a disruption to the area. And that's the same with our needling techniques. They speed up. They become more aggressive. And that's how we disperse. Or we even take something away from it. We bleed. So we have these two differences between supplementation and reduction, but the same concept of engagement of the Shen still rings true. How we actually engage, how we therefore supplement to draw something to create change, or how we actually talk to it in order to take something away. And this is what acupuncture is about. That is what classical acupuncture is about in the most simple ideas at all. Point selection, channel selection, all those things, of course, are vital to technique, to the right technique. Tool selection, as in the Jodzen, the 9 needles, they are also vital to that aspect of technique. So on top of that, we have this other aspect that once we are actually talking about engagement of Shen, once the Shen is perceiving and receiving our information and then relaying that information in order to create change, that aspect of change that is filling that empty space in there, that is the ji. Sometimes translated as dynamic change or sometimes as the mechanism. Ji was often used in regards to the old crossbow. If you're not familiar with it, I highly recommend that you read Jason Bensky's article in The Lantern, a sensational article called Axis of Efficacy. It's a 2-part article, and they discuss this concept of ji. You can read through that, you can go through that idea and see how it relates and translates into your own practice. And you can read, obviously, Ling Shu Chapter 1 and Ling Shu Chapter 3 and go through the concepts of that as well. So ji is this mechanism. Ji is the understanding that as we go to needle, the dynamic change that will occur between pathological qi and physiological qi, between xie and zeng. And as that change occurs, the space that it occupies, that is where Shen will engage, and that is how we actually obtain or how we enable the arrival of qi. That arrival of qi, from a classical perspective, is not just an electrical sensation. It is not just the sensation that bites at the fingertips of the practitioner, but it's also a complete harmonization. It is a healthy response on the palpable pulses of the body. In Neijing acupuncture, we palpate the pulse in multiple levels. We have obviously our Mai Ko at the wrist. We have Ren Yin Chen Ko, which is a Jingmai pathology, and we have Sambu Joho, which are the 3 levels and 9 indicators around the body, multiple pulses. But the idea is that we want a positive pulse change because of the needling that we did. So feeling pulse prior and after is about that engagement again. We are actually, every time that you feel the pulse, you are actually taking into account, you're actually communicating with and listening to that of that individual's Shen. The Neijing also says, in regards to not only just the course guarding the physical form and the superior guarding the Shen, but that the course guard the guan, what they call the passes or barrier passes, the joints, and that the superior physician will guard or defend the ji. It says, and I've got a quote here, the subtleties of needling lie in the speed. The course guard the guan, the superior guard the mechanism. The movement of ji is not separate from its empty center. The ji is the empty center, clear, quiet, yet subtle. As acupuncturists, we are trying to, at all times with our needling, work within this empty space in which ji is occupying. We are trying to observe the trigger that enables that ji, trying to activate it. Again, thinking of this classical concept of a crossbow. The mechanism of the crossbow is the ji, and then there is a trigger which allows that mechanism to manifest and work. We are trying to be the trigger. Our needling is trying to engage it so that that empty space can enable change. It is this concept of from nothingness, we have something that is being created. It is this concept of wu wei, this non-action creating action, this empty space creating the utmost change possible within that individual. Ji resides in the space, but it's the space between that non-action and action as well. It is the transformation between those two. So in that case, it is the pivot. And of course, Ling Shu is our spiritual pivot. It is the pivot between the unseen and the seen. It is the pivot between the Shen being dormant and the Shen being an active health response or response to disease. And that's where needling becomes a really fine, delicate measure, a process in which as we needle, in order to manifest the arrival of qi, in order to understand when we should actually even take the needles and withdraw the needles out, in order to understand changes in complexion, our needling has to be very, very precise. And this is what I call level-based needling. Now, if you needle to the right level, as I mentioned, at the right time, in that right space, with the right tool, then you're going to create the optimal change. Needling to the right level really means two things. One is that no matter where you are, even if you're addressing something simple, an acupuncture point, it may be a yuan source point, it may be jingwell or a shoestring point or something, or it may be a terrain-based treatment on the renmai. But the idea is that you need to understand exactly where the pathological manifestation is occurring along that pathway, and then once that pathological manifestation is identified, then you need to make sure that your technique will match that pathological manifestation in order to create change. A good example of this is something like Gulbi, bone-based bee syndrome, where there has been a really strong contraction deep within that yin dynamic, causing actual aching and pain within the level of the bone. Now, there's multiple techniques you can do. An example of a fantastic technique, duanzi, within Ling Shu Chapter 7, the guan, is when you take the needle, and in order to bypass all those other different tissue layers, we actually wag the tail of the needle in order to move through the tissue layers until we reach deep down, hit the bone, and then at the bone, we have to do something. We have to draw yang qi all the way down deep into the water, because bone is obviously representative of water and the kidney. It is in the depths. And there is a contraction in that depths, and we need to make sure precisely where that is, drawing down deep into that bone. And then once at the bone, we're going to actually continue to wag the tail of that needle as to irritate the bone. And I often joke with some of my students saying that's all we do in acupuncture. We are irritants. We go there and we piss people off. We piss the Shen off, and we go there and we poke it until it goes, all right, I'm going to actually go there and do something, and I'm going to create this change. We go there and we go deep and we start to just scrape the bone with duanzi. And as we scrape the bone, very, very minute, very, very gently, we draw that yang qi deep, deep, deep down towards that bone in order for there now to be the appropriate healing response or change. It's important to also recognize that a number of people approach their needling and approach their depth of needling or strength of needling the same from one person to another. And I think this is a mistake in acupuncture. I think it's a mistake to constantly do gentle light needling, and it's a mistake to constantly do strong, we may as well call it painful needling. What's important is doing the right needling for the right person. And you have to therefore, when you're palpating that pulse or palpating that channel, when you're engaging and looking at the person, we immediately interact with that individual Shen as soon as they see us. When we start talking to them, and absolutely when we start touching them. As soon as you touch that pulse, there is an exchange there. Again, it may be an unseen exchange, it may actually be very visible, and it may be something which is tactile on the actual patient. You may be able to see it, feel it, or see it in their face. But as soon as that engagement with Shen, you should be able to start to read the difference between that and enable the idea and the concept of whether this person is going to require something which is rather deep, maybe a strong or a fast stimulation, or whether it's going to be slow and delicate and light. Are you going to have to creep up on this person and entice that Shen to you, or are you actually going to be able to run at it? If you run at it, will it disperse? You're going to have to ask yourself these questions every time you needle. And that's why I think it's very important to take into consideration something which really doesn't exist in the same way in classical acupuncture as it used to, and that's the utilization of various tools. I do see it a lot in Japanese acupuncture, and it really pleases me to see these different tools, which are adapted from the Jōzen, used in different clinical practices. I certainly use them in some of my clinical practices, where instead of needling, yes, we may moxa. Okay, most people use moxa. One of the most common needling methods that I use, I enjoy it, is fire needling, okay, cuizi, quenching needling, where it is an aggressive technique. It engages the Shen immediately, but it's so specific and so targeted that that immediate engagement results in a very immediate reaction and result. So I find it to be one of the most effective techniques, but it's not for everybody. And then, of course, we have other aspects of needling as well, where we might be using blunt tools. We might be using tools to massage the vessels. We might be using bleeding tools. But you have to understand that each of these individual tools is like a surgical kit. And when we have that surgical kit, we can engage different tissues in different ways. The engagement of various tissues, the idea of engaging a particular level, is something which is not just unique to Neijing acupuncture, most people do it. Engaging the particular channels with particular tools based on certain diagnostic parameters is something which is very unique to Neijing acupuncture. But it doesn't mean it's a whole lot of localized needling. What it means is that once we've actually diagnosed that individual, once we get a grasp of the pathological manifestation and we go searching for it within these channel complexes, that is when we should start to tick over in our minds what tool should be used for that person at what level. Quick tea break. One thing I love about this Meng Fei Pua, and I think I mentioned at the beginning, is it just gets stronger and stronger, but smoother and smoother. If you can get yourself, unfortunately, I think I bought it for around $20 10 years ago. I think it's around 120, 140 US at the moment for a cake. But I really highly recommend it. It's kind of like good wine, right? You use it. The good thing with Pura, though, you can only use a small part, and it can last you, a number of hours or a day. It just gets smoother and smoother. The clarity of the tea, the clarity of the flavors of the tea, which is much like what we're talking about with needling. The clarity of the principle behind the tea gets clearer every time you have a sip, every time that you brew it again or pour water through it and start to understand how the leaves give off these different aromas and flavors. Anyhow, technique as a concept is one of the most simple things and one of the most complex things. And it really does depend, and it really comes back to the practitioner and how they approach it. The idea of today was to keep in mind that three little characters, shang, shou, Shen, which means guard the Shen. Always be conscious of it, always be conscious of its changes, always be conscious of how you're engaging it. And if you have that sitting there within your mind, if you are putting your mind into each aspect of that engagement, then what you're going to end up doing is really, one, respecting what you're guarding, the Shen, and then being able to observe, like an outside observer, observe that subtle dynamic change that is manifesting in a very minute, empty space within that individual. And once you have that, you will find that your technique becomes really precise, pure, and hopefully, above all, effective. That's all I have to say today on technique. We're going to talk about a number of different subjects with Tea With Huangdi. I have a few requests on various subjects. As I mentioned, none of them to be too technical, but of course, if there's aspects of technicality, we might start talking about specifics of pathologies and other things. If there's tea requests, there can be some, but they're not going to be tea reviews. It's just about enjoying some good tea with good old Huangdi. Thank you very much. I'm David White, and I'll see you on the next one. Take care.